Well, hello everyone. Hello everyone. Good evening, and welcome to this session. Myself, Dr. Nileshraj, faculty for pharmacology. With me, I have our eminent faculty of microbiology on board, Dr. Sonu Panwar, sir. Hello, sir. Good evening.
Hi, sir. Hi, Dr. Nilesh. How are you?
I'm great, sir. I'm great, sir. So,
Hello, Sonu.
so guys, this session is regarding. We'll keep it as short as possible, guys. I don't want to waste your time a little bit more because this is just an orientation of how to actually approach your second year subjects. Because you have just now finished your first year. First of all, congratulations all, because you have now started with the clinicals. You previously would have been gone into the early clinical exposure EC, but now you're going to the proper clinicals from second years. And in this second year, these subjects, the three subjects with this pharma, micro, and pathology, all these three subjects will form the most important core of all the 19 subjects, because it is like a stoppage. When we were doing our undergraduation times, the second year was actually a long period of around 1.5 years. And whenever we asked the question, why is it 1.5 year, we used to get an usual response that these three subjects are the most important one out of all the 19s. So you have to spend a lot of time in this 1.5 years. So that's how we were been drop up. But now it has been 1 year. Glad that it's been 1 year, because even if it is 1.5 years, हमको क्या कर सकते हैं, sir? We are going to be reading only the last 1 month. Well, that's how the whole year is going to be. But we have one another way of the point why like usually people read in the last 1 or 2 months is they don't actually know how to read the subjects, where to start and how to start. Because you're just now in the second year, guys, after finishing the first major topic in pharmac, which is general pharmac, and the second major topic in autonomic nervous system, after finishing these two topics, you will come to know that you are into second years, right? Because after the first two topics, you will land up in an FA or an IA, and you will get some very drastic marks, which everyone used to get. Don't worry about it. When you after you get to the drastic marks, you will know that, oh my God, I have to start studying, because you are in a high that you have landed up in the second year. You're now a senior in your college. And when you start with the next topic, and that's where the confusion comes, because without the basic knowledge of the first two topics, you will not understand the whole of pharmac. Well, that's where most of the students are actually lacking. Most of the students are actually having some issue with it. So we are here to make sure that this issue is being sorted out in a sequential way. I think let's start with pharmac, sir. Is that sir, Sonu Panwar, sir? Shall we start with pharmac now?
Yeah, sir, surely.
Yes,
Please tell
sure.
how to approach a farmer.
Yes, guys. I think we can. I'm going to be sharing a screen right now. Yeah. So I hope the screen is visible for you. Pardon me for that alignment issues. And how to approach pharmacology, we'll start with that. But see, guys, when you land up in second year, you will be having a small point like, okay, हम लोग second year पहुंच गए, so हम लोग senior है ना अभी, so there is no need to go for the regular classes. So we are having this collar up, right? Yes, it's happening. It will be there, because without that, it's not even a college which you are there in second year. But please make sure that the duration is as much shorter as possible, because those regular classes and the clinicals which you're going to be going, if you're not attentive in it, your preparation would be defective. You're not even half full, you are more than half empty, which means some people might be saying, some seniors might be misleading you, saying that, Hare, what exactly is going to be happening? Last 1.5 months, we'll just finish off all these things. That's good. That's easily you can pass it out. But can you learn these three subjects? That's the point which we are here to explain. Of course, we're not here to say like the usual sentences, no? From the day, start from the day one and proceed till day 65. Of course, it's easy to say, but I know how much difficult. We all know how much difficult it is to start from day one. No one can actually do it from day one. But we have some few techniques. There is no need to read 24/7, guys. We have few techniques. If you know that, it can easily be cracked up. Practicals, and most question is like, sir, we need to concentrate more on practicals or not? If you are planning for honors or distinctions, practicals marks will be the only one which is going to be boosting up you. Of course, practicals, apart from the marks, it is very much important for your practice and also for your clinicals, guys, for your knowledge which you have. But apart from that, as per pharmacology is concerned, more of, I think nowadays it has been moved on to theory. We used to have animal experiments. Now animal experiments are not there. More of clinical and case scenario based experiments are currently being there. So if you are planning to get a better marks in the main exams, practicals is the one which is going to be boosting you. Even if you have given like 200% in your theory, and if you have lost some marks in practicals, the final marks is going to be affected a lot. I will give you a basic introduction about pharma, guys. We have two major topics within pharma. One is general pharmacology. The other one, the remaining topics in pharma, which are called as systemic pharmacology. In general pharmacology, we have two topics, pharmacokinetics and pharmacodynamics. And regarding systemic pharmacology, these are the topics which is there in the list, guys. I have arranged it in the same way in which your reference books, be it your 𝗕𝗲𝗕𝗬𝗏 or be it your any other major books which you refer, this is how the topics has been arranged. And of course, most of the like your colleges will be following this pattern for their preparations also. If your college is better and if the college is following up alignments like horizontal alignments and horizontal integrations is happening, the topics might be jumbled because immunosuppressants will be coming up in the initially, like miscellaneous topics will be coming up initially. But don't get alarmed. Why? Because this is purely based on how you analyze those subjects in a horizontal alignment way from pharma, micro, and patho. All these three will be running up smoothly so that you will have an overall idea of what exactly happening within your mind. But according to me, whenever you finish off your first, second year SIP, when you start your preparation afresh for your main exams, this order would be a best order. Please take a screenshot of this, my dear guys. So I'm going to be classifying the whole of pharma into four major sections, section A, B, C, and D. Section A is where general pharma. Immediately after that, please start to read blood pharmacology. Don't expect the same order to be taken up in your sections, guys, in your classes, in your colleges. It will not happen because we have competency-based curriculum. That's a different concept, which we are going to be explaining up later. But when you sit down for preparation, no, you give like 1 month of time for preparing, 1.5 months time for preparing pharmac. This is how we have to follow that up. Initially go with GP, after that go with blood pharmacology. Then the section B includes autonomic, peripheral, respiratory, CVS, and kidney. Section C goes autocoids, CNS, hormones, and GIT. Section D is where your antibiotics, anti-cancer, and the miscellaneous drugs are. Okay. Right, sir, we understood the topics. What are the topics which you have to learn at first? So within that individual, within that systemic pharmacology, within that autonomic, within that blood, what are the subtopics which we have? We have introduction, classification, mechanism, pharmacological actions, PK, that is pharmacokinetics, uses, adverse effects, contraindications, and drug interactions. So sabko padna hai, sir? Yes, we have to read all. But again, as I've told, I'm not here because everyone can easily say that go and read, just read, anyone can say. But we are here to give you some nuances, how to actually approach that, which topic you should have to give more interest on. How to read pharma, be it any reference books, guys, be it 𝗕𝗲𝘀 or Goodman-Gilman. We have a book called as 𝗕𝗲𝘀, which is the primary reference book. We have Goodman-Gilman, one more reference book. And for Indian books, we have 𝗕𝗲𝘁𝗂𝗕𝗏, we have Padmaja, and we have Tarashenbag, and multiple other books are there. So mostly, I think students will be following up these 5 books throughout India, and even outside India, most of the students will be following these 5 books. But according to me personally, if you want to understand certain important topics like diabetes or hypertension or CNS like Parkinson's, epilepsy, there is a book called as GOLAN, GOLAN. An older edition, it was released, I think, 2005 or 6. But that GOLAN, which explains the pathophysiological aspects of pharmacology, is one of the best books to read the basics of the diseases so that you can understand the mechanism in an easier way. So if you are a little bit a nerd, or if you want to understand the basis very much clearly, I will request you to go with GOLAN. But no, sir, I just want to have a good exam, good marks in the exams. You just go with any reference books which your college is actually prescribing. So this is the last point which I'm going to be explaining, guys, how to read pharmac. First of all, we have several topics. As I've given you the list of topics, the same topics will be there in your reference books too. But how to read that? First of all, you have to read a case scenario, guys. The issue with we have the latest edition of 𝗕𝗲𝗕𝗏 doesn't have a case scenario which is put up in first. They have a problem-based study. Problem-based questions is there after every chapter. But you have to go through a case scenario. It is available in lots of different books. In 𝗕𝗲𝘀 it's there, and Goodman-Gilman it's there, and lots of case scenarios are there. Any topic, be it angina or hypertension or OPC poisoning, anything is going to be, you have to start it from a case scenario. You have to read it in depth. Step 1. If you are feeling difficult in finding a case scenario, the sessions which we have taken in the DocTutorials UG curriculum app, every session we have started with the case scenario. Now, after this case scenario, you have to think of the case not from a doctor's perspective, guys. Don't think about treating the case. Think about it from a patient's perspective. Think about how he would have felt. He is feeling, the patient is feeling fever, the patient is having cough, the patient is having an abdominal pain, and the patient is put up for an investigation. The reports has been looked up by the patients. You think about it from a patient's perspective. Only then you will remember those symptomatology which is there. If you look at it from a doctor's perspective, mostly you might miss certain symptoms, because you'll be looking into only those symptoms which you feel that it is important for you to come up with the diagnosis. But when you are in the learning process, that is good for diagnosis. When you finish your MBBS, that's good for diagnosis. We can come up within a fraction of a second. The diagnosis can be come up within a fraction of a second. But when you're in the learning process, it is always good to learn to understand it from a patient's perspective. You have to just imagine how the patient would have felt. Point number 3, get to know the disease. Introduction, no need to go in depth, guys. No questions will be asked in your exams. Just to read would be enough for understanding the concepts. Know the drugs, the classification, read once. Yes, I'm putting up the words, read once. Don't spend more amount of time in reading the classification when you start a topic. The point is, of course, you would have known your seniors, your professors, and all of the people would have told classification is important. Yes, when you write classification, you will get pass marks. Everyone would have told that from the start till the now. If you read classification, you will get pass marks. But are we here for pass, or are we here for a little bit more, right? If 100 people are there, 100 people can get pass marks. But how are you going to be outshining those? You have to go through in a different perspective. When you come with the classification, just read only once in a slow reading manner. That's enough. After that, you move towards the individual classifications, individual points. The 4th point, guys, know how the prototype drug acts on your body. We have to do it in depth, which is nothing but the mechanism of action. In-depth reading is necessary for that. Now, how the drug is affecting the different organs. It will be coming up in a topic called as pharmacological actions. Those pharmacological actions we have to read in depth. Know how to be administer the drugs, which is pharmacokinetics. Don't worry about it. Just go with the read ones. Don't spend a lot of time in reading in depth regarding the pharmacokinetic features. Regarding this whole thing, you have to read in depth only based on the mechanism of action and pharmacological actions. The other things you have to read once. Next, the topic is uses. And it's what in every systemic pharmacology, the next topic after pharmacokinetics is going to be uses. Within this uses, there will be 2 or 3 pages would be given, guys. For example, acute heart failure, then acute myocardial infarction, then we have lots of different topics that will be given over there. And you have to go through these topics. Those topics are must know. And those details which are present inside those topics are good to know. There is no need to go spend a lot of time in reading the full explanation of that. If you are well versed with the topics, you can go with the further details also. Moving on to the next one, contraindications. As per the contraindications is not given for most of the topics. Only for some topics, contraindications would be given. Topics, again, those are must know. Details, whether to know it or not. See, as per contraindications, topics are must know. But within those topics, for example, a drug is there, an antihypertensive drug is there, and a contraindication is hypotension. Of course, you would have known it. Any antihypertensive drugs will decrease the blood pressure. So contraindications क्या होगा? वहाँ पर hypotension हो जाए. So hypotension is there. You just look into the topic and think about why is this particular drug contraindicated in this disease. You think about it by yourself. After that, you go and read that. That thing you can save a lot of time in remembering those topics. There is no need to go. There is no need to just mug it up and mug it. That's not even necessary for that. Drug interactions. Of course, it will be difficult initially, but after the whole topic pharmacology is complete, you will know that the drug interactions would be a good revision concepts for you. After finishing up all the topics, you come back when you start with the first one, and you will know that this drug interaction is going to be linked up with that. When you come across drug interactions, please turn towards that particular drug and read about the second drug also, so that it will be a revision for you. This is the way in which we are going to be reading a pharma, guys. Remember this, in-depth is going to be needed only for your mechanism of action, pharmacological actions, uses, and adverse effects. These 4 are in-depth read. The other things, it's always better. You just go with that in a single go. And regarding the classification, guys, for the first time when you're reading a topic, just go through that for a single time. After that, you go with the pharmacological actions, read the full drugs, adverse effects, uses. And after that, you come back to the classification, guys. That is going to be very much easy for you. Because just simply randomly trying to remember some drug names, around 1,000 names would be there, guys. Around 1,000 names would be, even I don't know, around more than around 200 or 300. I don't know more than that. No one can remember that. Even I also accept. No one can remember the 1,000 drugs, right? But there are some ways in which we can easily remember the drugs, right? And those kind of things would be necessary. If I say that out now, it'll be difficult for you. You just now started your second yearship. So whenever the topic comes, your professors or your seniors or your batchmates would be telling a particular mnemonic. Remember that. Follow the mnemonic. That's going to be very much easier, very much cakewalk. Don't worry about it. Pharmacology is going to be as much simpler as possible. And last important one, question-based preparation for IA and FA, guys, for internal assessment and for formative assessments, and also for your main exams. Please don't go through that textbooks again and again and again. First time read, go with the textbooks. Next time, you go with the PYQs, previous year questions, PYTs, previous year topics, and MCQs. You have to go with question-based answer therapy. Only that is going to be useful for you. Don't spend a lot of time in reading the books again and again and again, guys. That's not going to be useful for your exams. All of these points which I have listed out is already been there. All of three of us, myself and Dr. Sonu Panwar sir for micro and Vandana ma'am for patho, we have all worked for it. So that all these points which I've told will be there in that particular videos, which is there in the UG curriculum among DocTutorials. And we'll be knowing more about that UG curriculum details as the time progresses on. I think with this, I try to close out the session with pharma, guys. I hope I've given you a basic overall view of how to approach pharma. If you have any doubts, I'm openly available for any of the other sessions, any of the other like meetings. If you want, we can have it. We can have a one-on-one meeting, and we can also have a mentorship along with me for pharma. Thank you so much, everyone. With this, I will pitch on to Dr. Sonu, sir. Sir, I think the floor is yours. Please try to explain to people and also to me of how to learn micro, because I'm a poor student of micro till now.
So you wonderfully described up that how to approach the pharma in the second year, because I think the pharma and the micro, you will like definitely agree with me. They are the real ones to handle up, because so much to learn and so much to like new drugs comes and their mechanism of actions. So a lot of things new that creeps in, and they are not easy to be remembered for sure. So a lot of different approaches are there, and a lot of different things are there which should be like used up for these particular MBBS second year students. Okay, so hi guys, this side Dr. Sonu Panwar, your microbiology faculty at DocTutorials, and we have made these videos as per the competency based NMC curriculum. And in the microbiology, sir, that scenario is fully changed now. Actually, before it was organism wise approach, and now it is totally system wise approach in the microbiology. Okay, so like previously we used to study up like these are gram positive cocci, these are gram negative cocci, this is gram positive bacilli. Like that we have to study and then separate their diseases and all that. Now what they have done, they have changed it to the system wise approach, that which particular organisms are there in the bloodstream infections, which is there, which are doing GI infections, hepatobiliary ones, genitourinary ones. So like that it becomes. So obviously now the students are fully confused. Okay. In the microbiology for the second year, students are fully confused, and I regularly take the Viva also, or the practicals and all. And I'm very sorry to say nowadays the students, they could not able to know this only, that this particular organism which you are talking about, is it a fungus, is it a bacteria, is it a like parasite or a virus? So that is a very bad state of affairs, which I say. But that all things can be overcome with this particular app of ours, the approach of ours. And I will definitely recommend up that we have come up in this particular app with an overview. First of all, try to know this, guys, that what is bacteria. Okay, try to know that which all are gram positive cocci. And this, sir, we have done in this particular app in a very simple and lucid manner, so that they have an idea regarding it. First of all, that what they are talking about. Because if you don't know that what you are talking about and directly jump upon to the system one, no use, not at all. So I strongly recommend up whenever you take this particular app of ours in the second year, that is especially in the microbiology, you should study first of all that what is gram positive cocci, what is gram negative cocci, what is gram positive bacilli, and what is gram negative bacilli. First of all, this thing should be clear to you. And after that, that which all fungus we are dealing with, what is yeast, what is true yeast, what is molds, what is dimorphic fungus. If you don't know this first and directly jump upon to the bloodstream infections and GI infections, you will not gain anything for sure. Okay, so this all things like by the experience and the students what they face of the difficulties and all, we have made this particular app in such a manner that first of all you should have a base, and the sir will also agree up the second year subjects are the base of yours. If you know pharma well, if you know micro well, if you know patho well, then your half of the medicine is done. Okay, your final year roots are these. They are the basic roots of yours. Okay, and if the roots are strong, then the tree will be wonderful for sure. Your success tree will be wonderful for sure. So guys, these three, they are the core. Okay, and nowadays, sir, like it's all clinical now. Like in the micro also, it's all system wise, clinical microbiology, clinical pharma, clinical patho. So right from the second year, you will go into the hospitals also, wards and also. And if you see the NMC competency based and all, it's all about now infectious diseases, sir. So they have incorporated the Harrison into the second year, the infectious disease part. The fully it's there from there, the tables and all that. We have taken up the standard references, the standard books which are there in the market, and try to be having as per them in our app, so that you do not feel anything problematic. So that sequence is being followed up. And I will recommend up whenever you go for the class that before that you study up from the app. Okay, and because we have covered it in a very simple lucid manner in the starting, so next day when you will go to the class, you will focus upon all those important points only, and that will go into your long-term memory for sure. Okay, so I will recommend always before the lecture that suppose you must be knowing now, you must have the schedule of yours before. Welcome, ma'am.
Hi, sir. Hi, sir.
Hi. And we are telling up, ma'am, regarding the approach up, that how to approach up the app first. So first of all, you should read from that particular app and then go to your lecture. And later on, don't forget the book. Whatever standard book you are following up, don't forget that. Then see that book. And that book journey will become very simple and lucid for sure. You will feel the difference that what that particular app in the starting have done for you. It will make the topic exactly easy, and you will be very very simple and lucid zone that yes, this topic, this I know. Otherwise, you know that in the second year, micro is a nightmare. Okay, so much you have to remember, so much organisms you have to remember. And at the last, I have seen up the students are confused in this only, that we are telling the virus, we are telling the parasite, we are telling the bacteria, we are telling the fungus. So that's the truth actually. So to avoid up all these, this particular app is being designed in such a manner that along with the pictures in the backdrop, which are 3D and 2D animations and all, so you will be having a fun journey of microbiology. And the approach which I've told up that we have in this like case scenarios also. So nowadays, a lot of MCQs are also coming up in the university exams. In this particular one, we have kept up all the university previous PYQs also and PYTs also. So you can focus upon them. You can practice of the MCQs and those case scenarios. I'm like pretty sure that if you do my case scenarios and you go to the exam, definitely from there only one case scenario will be there in the exam for sure. Because we have covered up, we know by the experience that which particular thing the examiner would ask. Okay, and you can very well feel in the practicals also that sir have told up this particular word that this is an exception, that Shigella dysentery type 1 is catalase negative. Why this examiner have asked me the same thing? Because that is having a clinical relevance. Okay, by a simple test you can differentiate up that this organism is problematic and how to identify that. Do this particular test. So that is what has come by experience. So we all have crept in all that particular experience into this particular app. That is for the MBBS curriculum. And definitely you will find your journey of the theory as well as practical very simple and lucid. And if you have any sort of queries, do ask me up on my Instagram handle in the DocTutorial app. Anywhere that particular thing will be solved up. And if you have any problem that how to approach of this subject and you are confused, that not able to handle up what is going on in the college and what is happening, if you miss out on any other lecture and all, how to approach up in the app and all, so everything is being told in a very simple lucid manner. And when you will have it, you will feel that yes, it have made my journey of second year easy. Okay, so this is what is from my side. And now, sir, I think Dr. Nilesh, Dr. Vandana should tell that how to approach up the pathology and which particular ma'am have taught wonderfully well. And I've seen of the ma'am's videos also. Ma'am, please enlighten the students regarding the approach to the pathology.
So Sonu sir and Nileshraj sir has already done my work easier. I think both of them have explained it in detail. So yes, so basically pathology is a little different subject from all the other subjects. Reason being is the pathology revolves around all the images. So so just a second, I have a PPT also. Can you just share the PPT? Is in the backstage. Uh, so there is a PPT which has to be projected. I think they'll project
You
anyhow
can just,
till the time. Yeah,
ma'am,
till the time.
in the present, you can just put up those, and I think we can put it up.
Just a second. Okay, they're doing it. Yeah. So basically, the point that I want to emphasize is yes. Okay. So there's a short PPT, just a very short PPT. So already Nileshraj sir and Sonu sir has explained in detail. So basically, what I want to focus here first thing is that pathology is a subject where you have lots and lots of images, and images are the key to understanding pathology. So whenever a student basically enters into second year, how is it different from the first year subjects is that you enter into the world of lot of colors, you know, blue, pink, and black and gray and green of immunofluorescence. So basically understand, समझ में नहीं आता है कि क्या करना है. That's number one. The second point that the confusion occurs is Robbins is a very, very vast book to study. And plus, the third confusion that comes is the CBME guidelines, which have been updated, and recently new guidelines have come down. So basically, the students are in a confusion that how should we study and how should we approach the subjects, and especially pathology, which has a lot of competencies. So the point that I want to highlight here is the number of competencies now. They highlight a topic. They highlight a topic which you have to study. So the most important thing is that you have to understand the basics. So how we have designed an app, I'm sure Dr. Sonu and Dr. Nilesh will agree with me. So we all have tried to make the basics clear for you. Once your basics are clear, you will be able to understand the competencies in a good manner, and you will be able to approach pathology in a systematic approach. And as Sonu sir just said, everything is clinical now. So only if you understand the basics, you have understood normal in your first year. Second year is about everything abnormal now. Now a person is diseased. So to understand that, you have to understand what goes wrong in the body to understand this. So pathophysiology is very important. Now, how is pathology different is that you have to know that morphology comes in play in pathology. So morphology means gross में क्या दिख रहा है, microscopy में क्या दिख रहा है, and how are we going to diagnose that case. So it is a completely integrated subject now. So once you understand it, so once you understand the concepts, you understand how it looks like, how the lesion looks like, you will be able to correlate it, how to give the therapy, like pharmacist will tell you how patho and micro are going to integrate. That is also very, very important. Both of them are very different subject. Pathology is a very different subject from microbiology. I hope Sonu sir will agree to that. So basically, I'm a pathologist. I do not know much about microbiology. Sir is a microbiologist. He doesn't know much about pathology. So it has to be taught nicely. You have to understand the concepts, as sir said. So sir will teach you more about bacteria, viruses, fungi, and everything. I'll teach you more about pathophysiology and how it looks, how you are going to diagnose it in sections. Plus, in pathology, we have a lot of hematology also coming up, which basically forms a big core of pathology. So remember, how do you approach it is follow the new CBME curriculum, download it from the website. And we have already made all the lectures according to the new CBME curriculum. All the lectures are according to the curriculum. So if you understand one competency, you'll be able to understand what is written in what all points you should know in that competency, because majority of the university questions are from your competencies only. So it's very, very important to understand the competencies and revise and study according to the competencies. So that's very, very important. Apart from that, practicals. Please remember, as Sonu sir and Nileshraj sir has already told, a lot of practicals are there. So you have to understand what all they ask you in practical and how to approach your gross and microscopy viva, and what all techniques can be asked, like urine examination can be asked, or ESR can be asked. So how and what all are you, how to make a smear can be asked. So what and all, how to approach, that should be very clear. So we have tried to make a lot of practical videos which will help you in understanding how are you going to answer in the Viva. So that is about competencies. That is how you're going to study. Plus, we have added a lot of flow charts in the app. So if you go there, after the end of every competency, there are small flow charts. That is the gist charts. So every competencies, we have tried to compile it into a gist. Okay, and also a lot of case scenarios. So after every competency, one case has been given. That is what I've done for pathology. So we start with the one case. I start with one case, and then I cover that competency. And at the end of the case, basically we close that case up, and a flow chart of how and what lesions, what all you should know about that competency is given. So that is how, that is very, very important for making your visual memory. कि flow chart आता है तो मुझे ये lesion आती है, because there are so many lesions at the end of the second year. You will be confused that there are so many topics to study. So make a flow charts. These flow charts will always help you. These gist charts will always help you revise your topic very, very well. So that is all. That is how I've designed. I think, and as all Sonu sir and Nileshraj said, most important way to study is know your previous year questions, university questions, not only the university in which you are studying, also the universities, other universities where you are there. Okay, so that's very important to understand which all questions can be asked in different universities, so that you know that these questions can be asked to me also. Majority of the questions are clinical based questions. So they give you a case scenario, and after that case scenario, the question is asked. So please be sure you revise all the previous year questions. We have tried to add as many previous year questions from different universities, so that once you go through them, you know what all questions can be asked and how the questions can be, कैसे घुमा सकते हैं questions को. So how do you say that in English? I don't know. So basically, so that is what you have to know that. So that is what all can be asked, and that's all about pathology. If I missed anything, so Sonu sir and Nileshraj sir, please do add on your points into that, so that it becomes useful, right?
Ma'am, you will agree that like no other platform is giving up competency-based videos of second year and the first year. So we are the one which are like first in the country itself, which are coming up with this competency-based curriculum of the NMC. And in my subject, ma'am, the things are fully changed now. Like before it was organism-wise approach, now it is system-wise approach. And because of that, a lot of confusion is there in the, like what do you say, student's mind.
Yeah.
So that is also there.
That is why, sir, that is why I highlighted this point very importantly, sir, that competitive preparation is a different preparation. That आप थोड़ा सा भी पढ़ लोगे, previous year questions पढ़ लोगे, enough है. लेकिन जब हम curriculum की बात करते हैं, तो you should know the topic in detail. Okay, this is why should you know the topic in detail, because if you're good in micro, patho, and pharma, you will be good in your clinical subjects also. Second year forms the base of your MBBS. So that is why it is very important to study from the subject expert. That is very, very important. And once, obviously, sir, you can teach micro in a way in which nobody else can, or sir can teach pharmacology in a way in which nobody else can. So this is one thing which is there, because we are basically teaching students in so many years now. We know these topics, how we should know that. So that, I think that forms the core difference of teaching students in a way in which they should know the subject, not only to pass the entrance examination, but to understand the subject, so that they can give any exam in the world in future and they will know the subject. I think that is very important for your MBBS.
Exactly,
Yes,
ma'am. Yeah. Actually, one of the things, like students, whenever they are like, for example, they are in the classes, usually students might get zoned out, because we're all their after all second year students. It usually happens in the classes. So when they get zoned out, like in like 5-10 minutes of time after they come back, it will be difficult for you to follow that up, what exactly you missed. And I'm damn sure that if around 100 students are getting zoned out, none of those students will have the guts to go back to the professor and ask us, sir, what did you say that 5 minutes I actually zoned out? No one can actually say that, because that's how the system is actually. But what if you can go back? No, as Sonu sir was also explaining about that previously. Just before going for a session, you just go through with the video, either in 1x or 2x, or whenever you have time, you just go with that. No need to take down notes initially. As I told, don't need to take down, just look into that video. Go with 2x, just understand what exactly is happening. After that, you go with your regular classes. We're not saying skip your classes. Regular classes is the only way in which you can learn everything. All of us, we are just aiding your knowledge,
Yes.
right? So we are all actually progressing. Go to the regular classes, you look into those classes, you use that as a tool of revision, guys. Use that as a tool of revision. You take down notes in your regular classes, you come back, and just before your IA, just before your FA, you take out that same video and go with that in an in-depth manner. Any additional points we'll be discussing, you just note it down in your notes and make that as a complete notes for your exams. Well, that's how you're going to be shining up very much bright. And we give you, mostly I think none of the faculties will be giving you, but we promise you that you're going to be coming up with colors if you follow this particular pattern. And
Dr. Nilesh and Dr. Vandana, like one question is there, that hi doctors, how to remember the concept easily. I have been thoroughly reading and remembering concepts, but at the time of internal exam, I'm not able to remember the concept. So what to do for this, sir? Any remedy?
For pharmacology?
Okay, so that is one thing I told, that at the you have to make flowcharts, as Nileshraj perfectly said, that we are aiding you to, if I'm talking about pathology, the Robbins is the key book. So what we do is there is no substitute to reading books. If you read books, it always, it will always take you to the depth of the subject. But what we are doing, we are aiding you to understand that subject in a better way. We are trying to integrate it so that once you read it, it stays in your brain forever. Now, the most important thing to remember, I told you at the end also, you have to make the visual chart or the flow chart or the end chota sa of what you have studied. So if you have studied esophagus, in esophagus, what all lesions are there, make a gist out of it. Okay, esophagitis, these are the esophagitis, these are the esophageal tumor, these are the common ones. Once you make a small gist chart of everything, you will never forget it, because it will be easier for you to revise. I think Sonu sir and Nileshraj can tell more about it, but that's what I feel will always help you.
True, ma'am. True.
Exactly.
No doubt.
Pharmacology, the thing which I actually didn't do that in my undergraduate times. No, in UG, I was just I didn't know how to read that. There was none of the, because only thing is DocTutorials was not there when I was doing undergraduate times. I'm glad DT would have been there at that time. But the point is, when I was preparing further, I found out one important thing, especially for remembering pharmacology. I started creating mind maps. As ma'am was clearly saying, no, let's put up a flow chart. Everything, as I've told, will follow a pattern. The whole of books will follow a pattern. You find out that pattern, and with that same pattern, you just draw a flow chart. Notes taking is utmost important, guys. Lots of the students are not doing that. During the classes, they are just observing the classes and just go back and look some shortcuts, shortcut videos. Don't go through NEET PG videos. Right? NEET PG videos would be good for as a like fast asset revision, no less for the main exams, because we'll not be targeting more on the mechanisms. We may not be targeting more on the classifications during the during our NEET PG classes, right? Most of the students are actually following that. I don't know why. For your undergraduation times, we need more on basics. The questions will be primarily from the basics. In our NEET PG classes, I'll be talking a lot about drug interactions and contraindications. But guess what? When a question comes, if you write contraindications and drug interactions for 2 pages or even for 3 pages, the maximum marks which you get is 2. They're not expecting drug interactions, contraindications. They expect mechanism of action. They expect classifications. You have to go with that. Please remember that you cannot learn like 5 years. You cannot learn the 10th grade when you are studying 5th grade. Please go with the 5th grade in a constant way. Please go with that in a basics way. As sir was asking, like Dhanu, how to remember the concepts, please try to make mind maps, or please, like pathology ma'am, like Vandana was also saying, please make a lot of flow charts. Sir, sir, what's your best thing to say to Dhanu?
Same only, sir. Like you have to have those particular racks, like the books you keep now, like GPC. Until you know that what is GPC, then gram negative foci, that approach always helps. When you systematically put them in a particular way, that this I'm reading bacteria, this I'm reading this. So until you don't know that, you will not able to learn the things for a long time. You will remember for a short time, and then you will forget up. But if you have a like flow, what I say is you should read in a flow. That firstly I have read this, then this, then this, then this. So when you have that flow in your mind, now that same mind map stuff, and ma'am is telling flow chart, until you have that, you will not remember it for a very long time, for sure. And ma'am, Vandana ma'am, like what about the practicals? Like we have done the real practicals in the lab scenario. Somebody was asking like, is it just writing on the PPT, the lab practicals,
No,
or you really have
I think
use of
you
the
should.
labs and all for
I
that
think
particular
you
one?
should see the practical videos. They are completely practical. Okay, so they are like how you do it. So if you look at the PPT of how are we making a peripheral smear, you can see it's a practical smear that somebody is making, and the steps are completely highlighted. How much amount of blood you should take, at what angle you should keep the cover slip, all the small things, nitty gritty things which you should know. Okay, the blood should not reach the edges, chota things which are very important for you to understand. And for anybody's information, I don't think any of us do PPT teachings. We do not do PPT teachings because we don't believe in it. PPT teachings is something which is a very redundant way of teaching, because if I'm doing PPT teaching means there's no difference between me or somebody reading out a PPT. So it's a very redundant way. So the way we teach is in the flow, as Sonu sir said, it should be in flow, that how this happens, what the next thing happens. And in practical also the same thing. We have tried to show you how you have to do. If I'm showing you ESR, then how I want to fill the Ewing-Grobb's tube or a Westergren tube has to be shown. That is shown to you. Or if I'm showing you blood grouping, then the gel card is properly shown, that how we have to do. So that it should be all of us. I think every one of us. None of us believe in rote learning. We do not believe in that. We always believe that it has to be taught in a way in which you are able to understand. Because I know when I was an undergraduate, there was nobody to teach me or tell me that this is the correct way in which the things have to be done. So once when I come on the other side of the table, I know these are the things which undergraduate wants to know. So I would definitely try to make things easier and simpler for an undergraduate. So that is what I've tried to do, and all your feedbacks are most welcome. This is I think this platform, the good point about this platform is once you give the feedback, we are always open to do something new. So maybe you can tell us that, ma'am, we want a practical for this, we want to hear more about this. We are always happy to do that. It's something which is ever evolving. It's always working on feedbacks. You can tell us, ma'am, we want more of it. I'll be happy to record it. Or I think anybody, Sonu sir or Nileshraj sir, will be happy to do it for you, because we are here to make things easier for you and make you a better doctors in future, and help you clear or know everything about the subject which you should know. Right, sir?
Yeah, very right, ma'am. Very right. Yeah, Nileshraj sir, something planned?
Actually, as Aditya was also asking, like whether it is going to be in lab recordings or writing in PPT, I have looked into the practical videos of Patho and Micro, guys. You wouldn't know to what extent we all actually go to teach you, because we don't actually have the patients nearby. We don't actually have you nearby. No, we cannot ask you to let's hold your hands and put it up on the vein and find out how the vein is, palpate it. I cannot ask you to put that things. But for making sure that it is being done right, especially whenever it's going to be there in your hands, we have been to such an extent that initially we have done for the IM intramuscular and subcutaneous injections, and we were doing it with the mannequins. We put up the mannequins. Based on the mannequins, everything has been done. And at one point of time, I want to say that to sir and also ma'am. And one point of time, when I went for the recordings with the mannequins, it took some time for the mannequins to be taken back to the recording studio. So I thought of I just asked with the cameraman, and I asked her, like, are you free? Can you please sit down? And I've just put an IV injection for you. And guess what? And he told, okay, sir, no problem. And he came and sat nearby. I'm just kidding. So, but he took it very much seriously. He just, no problem, sir. You can just put. I hope that you put the injection on the first one. See, we're all here trying to make sure that everything is being done as much in depth and as much in personal hands as possible. And of course, as ma'am told, we are ready to do, because of course that's what subject is. Everything is going to get upgraded. We need to upgrade yourself. You just need to take a look at the videos which we have done. None of those was PPT based. We're not, as usually told, we're not PPT based. PPT based, there is no need for a class. I will just share the PPT to you. You read that PPT. Right, but we are not here to explain about that PPT. No, we are here to explain with the 3D and 2D animated videos. You take a look at that. I think in few minutes your the video will be released. So you just take a look at it, and you yourself will know that the importance of this particular app-based videos, especially the DTUG curriculum, is in very much in depth, which I am very much sure that no one else can replace it. Over to you, sir.
Very right, sir.
And most important thing I want to tell everyone is that this was one of the comment that I got from one of my students saying that, ma'am, ज़्यादा नहीं पढ़ना होता है हम लोगों को, थोड़ा ही पढ़ना होता है पास होने के लिए. So that is one thing which you should avoid, guys. This mentality should not come into your brain that I have to, you know, second year is a enjoying year and I am out from the first year. Now I have to just read that 𝗬𝗕𝗕𝗦𝗁 𝗪𝗃 which is going to come in the market and I have to just read that and pass my exams. No, guys, that is going to be the biggest mistake of your life, because second year is one subject that is going to build your base. And if you do not do that in your second year, if you do not focus on your concepts in the second year and you focus on just passing the exam by just rote learning or by some 𝗬𝗃 which is coming in the market, I'm going to tell you this it is going to be the biggest mistake of your life, because your basics are going to remain poor, and then your medicine, surgery, gynae, your all the clinical subjects will be poor. And at the end of the time, you believe me or not, hard work always pays off. Once you have made your concepts well, you are definitely going to succeed, because all your clinical subjects will be like a cakewalk for you, right, sir? What do you think about it?
Very right, ma'am. Very right. And important is like basically like don't be overburdened that you have to do study and all, because definitely everything should be done along with the everyday reading, because when you do it in the last 2 months or last 3 months that I now have to pass, then that always creates a panic. Okay, so then if you on the regular basis read now, then the things they change, and that is what we say, antigenic drifting. You do every day, you should be a better version of yourself. If you apply this mantra in your life, drifting, that is single point mutation on everyday basis, you will be a better version of yourself, and that should be done. Enjoy your second year also, and along with that build your concepts with us, like with ma'am, with Dr. Nilesh, Dr. Vandana and Dr. Sonu, and definitely you will achieve good marks also. Your base will be also strong, and you will be a better doctor for sure.
I think 2 hours a day. You should be like one apple a day ki jagah 2 hours a day I have to read. That's what
True.
that you should have in your brain.
Exactly, ma'am. Like, one of my seniors used to say that, no, read to understand, remember to pass.
Yeah.
So if you try to remember everything, you will not able to pass. No, you will not able to understand that. The point is, remembering is different, reading is different. When you read, you understand. When you understand, you remember. When you remember, you pass. Everything will be happening in a sequential basis. You cannot skip a step. If you skip a step, the final concept is not going to be there. Again, I'm not here talking about only the pass. You might think like, okay, I'm a distinction in first year, I'm a honors in first. This guy is talking about pass. See, passing is different and distinction and honors is different, right? We are all in eligibility exams. We are not in competitive exams. Secondary exams is purely eligibility. 51% marks will be there with you, resulting into the same session, same classes which you are facing. You might be getting 92%. Right? So here we are not there for marks. We are here more to understand it in a clinical way. Well, that's why we are here for. And don't worry, with PYQs and PYTs and with the help from Vandana ma'am and with Sonu sir, I think it is very much sure that you can be coming up with very much good colors. I think, sir, that I think
you will agree with this fact that we have kept those students also in the foray, like those who are the last runners. Every time they are last runners, so we used to tell up in our lectures also, this is what is important. This is what is important. This will be asked. So that which you are telling now, this will be asked. That will be asked for sure. Okay, because that is on the basis of the scenario, like your experience of the last 20 years and all that. That is there in this. So that will be asked for sure. So if you are, obviously, a lot of students will be there, sir. Best is to have the basics. Best is to have all those sorts. But if you are a last time runner, that also is being crept up in this. So you can go up with that particular case scenarios and all. So that is not the correct approach for sure, definitely. But for them also, we have taken care of that if you are of that sort. But the best is build up your concepts. And if you have good concepts, you will be a good clinician for sure. Okay. So that is what is my last words for there. And best wishes, students.
Thank you so much, sir. And thank you so much. I think we can wind up the session if that's
okay.
Yes,
so
ma'am.
you.
Thank you so
you
much,
so
sir.
Any queries
Thank you
you
so
have in
much
mind?
today, and I hope that we have did some goodwill for the students. And bye bye, good night. We'll meet up with one more session, and it's going to be, I think, educational most probably. Bye bye, good night.
Best
Thank you
wishes.
so much.
Right.
Thank you so much, sirs, and thank you, students. All the very best, and I am sure you will be, you will be gaining some benefit from out of this session for sure, right? With that, signing off, guys. Bye bye from
Bye.
Dr.
Good night.
Dr. Nileshraj, Dr. Vandana. Bye, sir.
Hello students, this is Dr. Nileshraj, faculty for pharmacology from DocTutorials. Guys, learning medicine is not easy because we're not going to be dealing with some non-living things. We're going to be saving a lot of lives in the future. You will understand the importance of pharmac when you start your practice, and you will be having a lack of knowledge. You'll be having a dark area. You'll be having a black hole in, oh my god, I have forgot this concept. Oh my god, I have not learned that concept. Don't worry, to prevent all these things from happening in the future, and also for understand pharmacology in a different perspective, from a cell's perspective, from a clinician's perspective, from a patient's perspective, we have designed it in such a way that taking you inside the cell, inside your own body, and showing you what exactly is happening inside it when you are taking a particular drug, and what will happen when you are talking about adverse effects also. Join with us for this beautiful adventure. Pharmacology is not actually easy. At the same time, it is not actually difficult. It's going to be the most beautiful subject which you have ever learned out of all this MBBS, and we all promise you that.
So hi guys, welcome to pathology. It's a different subject altogether because it's a world of pink and blue. We have CBMB 2024 guidelines. You see that there are 35 topics and 182 competencies. So to make it easier, what I have done is I have designed a curriculum for you, because at the end of the second year you should be able to read your pathological report and you should be able to interpret it. So that is very important. You should be able to do the hemoglobin estimation. You should be able to make a 𝗵𝗡𝗏. You should be able to identify the blood group. So to make your concept stronger, it should be easier for you to understand, okay, what are these mesangial cells, 𝗷𝗫𝗄𝗏 glomerulonephritis. You should be able to understand what goes wrong in sickle cell anemia. How does it cause this problem? You should be able to understand what's going on in the liver, which is causing jaundice. Why a patient is developing microcytic hyperchromic anemia. Why is the iron not getting absorbed? It's just a video which helps you understand what's going on in the body. If your pathology is strong, believe me, all of your clinical subjects are going to be strong. So trust the process, be with me, and let's love pathology. Right, guys?
Hello friends, this is Dr. Sonu Panwar, your microbiology faculty, and I am very happy to announce that we are coming up with microbiology UG videos. And these particular MBBS curriculum UG videos, they are competency based as per the NNC guidelines. What we have in this is, I am giving you some tips and tricks to remember of these particular ones in a better way. Along with that, the practical approach is also being given off. All the practical videos I will also upload up. So all this is being kept up in this MBBS UG curriculum videos of microbiology. So this will be a fun journey. So do join up for this particular course.